Mr. President, I come to the floor today, as I have just about every week since the health care law was passed, to give a doctor's second opinion about the health care law. And I do that because I practiced medicine in Casper, Wyoming as an orthopedic surgeon, taking care of families from all across our state. And I have significant concerns about the health care law as it was passed, the way it was passed, what was included in the law. So I come to the floor today because the American people continue to see one news story after another, uncovering another error in the health care law, mistake in the health care law, glitch in the health care law, call it what you will. Another of the health care laws say unintended consequences, something that those who voted for it didn't foresee as happening. And they're also seeing another one of the president's broken promises. So I come to share with the American people concerns I have as more and more of these things come forward, because hardworking individuals, families all across the nation realize that this health care law was not passed for someone like them. What people asked for, the reason that we went through the discussion and the debate, had to do with the fact that people wanted the care that they need from the doctor that they want at a cost they can afford. And when I say that people all across the country realize that the health care law wasn't passed for someone like them, and it was passed for someone else, is the reason I come to the floor today to talk specifically about something called the Early Retiree Reinsurance Program, which was part of the health care law. Well, on Friday, December 9th, a week ago, the Department of Health and Human Services announced its plan to shut down the Early Retiree Reinsurance Program at the end of this month. Shut it down. Now remember that President Obama and Washington Democrats touted their Early Retiree Program. They touted that as one of the health care law's they called it an early deliverable, something that would be there immediately. The health care law's supporters said that this Early Retiree Program would act, they said, as a bridge. They said the program would help employers maintain health insurance coverage for retirees over the age of 55, but not yet eligible for Medicare. They said that this program would help people keep their insurance plan until the new health insurance exchanges were up and running in 2014. Well, it's only 2011 now, and they're trying to talk about a bridge to 2014. Well, it quickly became clear that the program was really intended to be a bailout for companies with a large number of union employees. On October 31st of this year, Halloween Day, senior senator from my home state of Wyoming, the ranking member of the Senate Health and Education, Labor and Pensions Committee, Mike Enzi, released a report. And in that Halloween Day report, the report is one that the senator had asked for. It was a report he asked the Government Accountability Office to conduct, specifically looking into the Early Retiree Program's implementation. And this is why the report is so scary. Well, the GAO, the Government Accountability Office, said that through the end of September of 2011, the administration had already spent more than half of the $5 billion allocation. More than half already spent by September of 2011. Well, now let's fast forward to December 14th, 2011. We're talking about yesterday. The House Energy and Commerce Committee released updated information about the Early Retiree Program spending. Well, as of last Friday, December 9th, 2011, the Obama administration, the people in charge of this bill, the people who wanted it, passed it, said it would work, have said, oh, we've now spent over $4.5 billion of the $5 billion budget. 91% of the total Early Retiree Program budget, supposed to last through 2014, 91% of it gone. A budget should have lasted 1,300 days. Instead, this administration drained the money, taxpayers' money, hard-earned dollars, in just 579 days. The Early Retiree Program has run out of money so fast that it's going to be forced to close 2 years early. The administration has said it's no longer going to pay out claims submitted after December 31st of this year. Well, Mr. President, the healthcare law's supporters promised the early retiree program would stay in place through January 1st of 2014. What we have here is another broken promise. Just a little over a month after the GAO report was released, we are now finding out that this administration spent more than $4.5 billion of the total $5 billion allocation that was supposed to last till 2014. So how did this administration, one that is claimed to be fiscally responsible, one that claims to be accountable, one that claims to be open, how did this administration allow this program to run out of money years ahead of schedule? Well, it went broke because certain corporations and union-affiliated organizations rushed to grab a taxpayer bailout. It is astonishing that the healthcare law's supporters forced the American taxpayers to foot the bill to keep private companies and unions' health insurance benefit promises to their workers. Most Americans would be shocked and outraged to learn that the administration did not even require companies to disclose their earnings in order to get the early retiree program funding. Let me repeat that. The Department of Health and Human Services chose to not mandate that employers prove that they needed funding from the early retiree program before approving the applications, and then sending them, those corporations and those union plans, taxpayer dollars. Department of Health and Human Services said, nope, here's your money. News reports indicate small businesses asked the administration to set up a review process to stop the government entities and the unions from consuming all of this early retiree program money. Well, according to the GAO report, the administration refused. They decided to distribute early retiree subsidies on a first-come, first-served basis. Well, the GAO findings in the House Energy Commerce Committee report suggest the Obama administration used the early retiree reinsurance program to reward its political allies. These two reports suggest this administration did so by directing most of the program's resources to plans serving unionized auto and government workers. This is based on the administration's own data. Based on the administration's data, nearly half of the entire $5 billion program will be spent on just 20 entities. And it is fascinating that the most money of all went to the United Auto Workers Retiree Medical Benefits Trust. So how much did the United Auto Workers need? Well, they took $387 million. Over $387 million. Administration officials said that the reason that they're giving away the taxpayers' money so fast, they said, is because the program is so popular. Mr. President, spending money fast doesn't mean that this government and this administration is spending taxpayer dollars wisely. Like so many parts of the healthcare law, the early retiree program just throws money at a problem rather than trying to fix it. We could have worked together in Congress. We could have worked together to help our nation's early retirees have better access to health insurance. We could have done it by enacting meaningful health care reform that actually lowers the cost of medical care. Remember, that's what the president promised. That's what he promised in a joint session of Congress. He stood up there and he said under his plan, the cost of health insurance would actually go down. He used the term about $2,500 per family per year. That's what he promised, that the cost of health insurance for American families would go down by $2,500 a year. But what are families at home seeing? Well, they continue to see the cost of their health insurance go up, and go up a lot. The president and Washington Democrats squandered their chance to enact real health care reform. And they did that the moment that they decided to ram a very partisan health care law through Congress and ignore the cries of the American people at home who said, stop, do not do this. Now the American people are seeing once again the consequences of those actions by this president and the Democrat-controlled Congress, seeing that the consequences are ones that they, the American people, continue to have to pay for. It's time to repeal the president's health care law. We need to get back to patient-centered care, the care people need from the doctors that they want at a cost they can afford. At this point, I continue to come to the floor, Mr. President, because I continue to believe that this health care law is bad for patients. It's bad for providers, the nurses and the doctors who take care of those patients. And it's terrible for the American taxpayers. And that's why as I go home every weekend and talk to people around my home state, they say, this wasn't passed for me. This was a law passed for somebody else. It's why seniors on Medicare know that $500 billion of the health care law was taken under the health care law was taken from Medicare, not to save Medicare, but to start a whole new government program for other people. It's why the popularity of this health care law actually continues to go down, and it is less popular today than it was the day it was passed. So, Mr. President, it is time to repeal the president's health care law and replace it with health care proposals to help Americans get care they need from a doctor that they want at a cost they can afford. Thank you, Mr. President. I yield the floor.